somebody there now.
That's Lee Guys. Just saying
Yes.
hello to you.
Thank you. I can see you there. Thank you. Well, we will go ahead and start our meeting. And I just got word that is Dr. John Gray on? I don't see him on here yet. And I just got word that one of our TAC members, Dr. Schuler, was not going to be able to be on today's meeting because of I don't know any details other than he was in a suicide prevention seminar meeting or something that just came up. So I don't have any details. And Dr. Petrie has a speaking engagement in Las Vegas today. So he's out west. And I was trying to see, I don't see Dr. Gray on the list yet.
Dr. Bobrovsky?
Yes, ma'am.
Does that mean that you don't have any TAC members, other TAC members present besides yourself?
I guess it's going to be me. So we do not have a quorum. But there's I guess a few, and I apologize to everybody because I'm just finding some of this out myself of folks that are not going to be able to be here. So is Miss Charlie doing okay?
She's improving, but she's still out.
Okay. And if and I asked the other day if anybody wants to send her a get well card, that to just send it to the office there at Frankfort, and they will get her the card. So if anybody would like to do that, have at it. I know sometimes it's just nice to know that folks are out here thinking about you, and we do wish her a speedy recovery. I'm going to go through here. I guess I can still go through some of our items to ask about the report, or should we just call the whole thing off?
Well, you don't have a quorum, so you can't make any decisions.
Right.
Certainly. I think how you want to proceed is pretty much up to you, other than knowing that.
Okay. Let me go through a few little things here. So obviously we are probably going to get done a little early today. And so that'll be okay. Then I've got some patients coming after a while anyway. I can see them, and we'll get the day going. But we can't approve any minutes or anything like that. But do you all know is the status on the MCO and state contracts? Is nothing's changed there yet?
Nothing has changed. It's still pending action.
Okay. I did want to let you all know that the KDA meeting in August, and I want to thank Dr. Caudle and Quan, Dr. Watson, and Dr. Adam Rich, and other folks from each of the MCOs that were there. I want to thank everybody for their input, and I know Dr. Caudle did a wonderful job on the. We had probably a good hour, hour and a half or two or whatever of charting and record keeping. And I wish there'd have been a few more folks that would have been there for that part of it, especially. But anyway, we had a socially distanced room, just about full, but we want to thank everybody for participating in the Medicaid Forum. And I'm going to jump back up here. I'm just going to go through, it's number 4 on the agenda. Is there any kind of comments or questions related to fee for service? Okay, hearing none. I'm going to go kind of in alphabetical order there with Avisus. Does anybody have any reports? And I know one thing, and I apologize, and we can add this to the next time. I forgot to get this one note on the agenda. Was I know we were going to talk about each of the MCOs of, look, we're going to look at the social determinants of health, by the MCOs and those impacts on oral health and total health care. If anybody's has got that, I'm just feel like it might be better to maybe wait on those until we have a full TAC member attendance for all of them to hear it, just besides me. But is there any other reports that you might have or questions? And I'll just start with Avisus and those MCOs, and then go to DentaQuest, and then we'll go to United Healthcare. So Aetna is what I've got down there first. What about Humana?
We have no questions. Thank you.
Okay. And then Passport. And anybody from WellCare?
Yeah, Dr. Bobrowski, this is Stuart Owen.
Yes.
Uh,
Yes.
Nothing to report. Would you like for the next meeting an agenda item for MCOs to talk about social determinants of health?
Yeah. Let's move that to the next meeting.
Okay.
And then that way, did you have some prepared comments on it yet? Even though I forgot to put it on the agenda?
No, nothing prepared, but I was going to say, yeah, if we can put that, make that efficient on the agenda next time, that'd be good.
Okay. I've already made my note to put that on the agenda. And I had I hope this doesn't happen to you all, but I had a note on my other piece of paper and just to add that on the agenda. And I guess when I was typing that up, I just let it slip right off of there. So, all right. We'll do that, the social determinants report for the next meeting then.
Sounds good.
All right. Thank you, Mr. Stewart.
Sure.
DentaQuest, do we have a representative there?
Hi, Dr. Bobrowski. This is Christina Medina from DentaQuest. We don't have any questions or concerns at this time, and we look forward to talking about the social determinants of health during the next meeting.
Okay, good
We
deal.
have some good
Thank you.
ideas, but I agree. I think it's best just to wait for the panel to be present so that everyone has a opportunity to give their feedback and ask any questions.
Yes, good. Thank you. United Healthcare, Dr. Rich?
Hey, Dr. Bobrowski, can you hear me?
Yes, can hear you.
Oh, good. All right. No questions at this time, but looking forward to the opportunity to present on the social determinants of health as well.
Okay. Very good. I'm going to move down to old business there. And I did not check, is Dr. McKee on the call today? here. All right, we'll add that to the next meeting there also. And I do have a question going down into new business there. We did get a response from DMS on the TAC recommendation at the last meeting. It says on there that DMS would get county-specific provider data on a quarterly basis showing activity levels for gross payouts beginning 1/1/21. And I didn't know if you were going to go back and get all of 21's kind of report, or was that just going to start on 1/1/22? It was written down in the report that I got back from DMS there that it was going to be 21, but I just wanted to verify that that's the correct date.
I believe,
Leader,
I'm sorry, Dr. Bobrowski, I was talking on mute. I believe the date is correct. I
Okay,
believe the date is correct. I don't think that we're gonna, yeah, but so we're gonna go back that far and show you the quarters, but I don't believe
Yes.
we're gonna be able to start having the actual report done until 2022.
okay. Well, that's kind of what I thought. But I just wanted to make sure I had everything written down right and that I was correct on that. So, okay, good deal. Thank you.
You're welcome.
And going down, I did want to let you know that on the MCO and the contracts with the state, the KDA has formed a work group to look at that, maybe have some suggestions. And I just wanted to say we as dentists, we do appreciate the opportunity at least for some input on that. And the next item is I do want to thank Commissioner Lee and other folks that have been attending. We've had some periodic, just some Medicaid issues, talking day, and we appreciate you all, letting us bend your ear and trying to make things better, for our dentists, in turn, who are able to help our patients. And then, yes, go ahead. Did somebody say something? Okay. And I did want to give a report to the fact that the KDA is looking for a new TAC member to replace Dr. Brandon Taylor. So we'll give that report. And I was looking at setting the dates for our next meeting, and whether or not to continue with the Zoom process, or has anyone from the state heard anything about opening up the Capitol or any of the places up there or not the Capitol, but your all's building to do in-person meetings, or do we think we should still go with just plan on the Zoom for another meeting or two, or all of next year? I haven't heard anything.
So I can give you a couple of updates on that. One is that while Medicaid is looking to obtain the equipment and the technology to have a hybrid meetings, in other words, some people present and some people by virtually, we're not there yet.
Okay.
It will probably be sometime early to mid next year before we can get all the way there. So we're hoping that you will wait until then so that we can make arrangements to, kind of satisfy those who want to meet face to face versus those who would prefer to have a virtual option as well. The other thing is that, of course, the first part of the year will be the session. So there won't be any other rooms that have that hybrid capability available because the General Assembly will be using it. And
Okay.
a lot of the other TACs are kind of following the MAC's lead and staying virtual for now. And then just
Okay.
take it up, maybe in a couple of more meetings after the first of the year.
We can definitely plan on, I mean, typically we'll have a meeting in February and then another one in May. And we can definitely, kind of be planning that those two first ones at least will be Zoom. And at least that way it kind of gives us a way to plan our days and go forth like that. So,
Sure.
and I think I see a typo I made on the next item. The elections will be held at that first February meeting, and I think I had down tentatively was the meeting would be on February the 11th, and I think I hit the 22nd on the next one. So I'm going to lay that up and blame my fat, chubby little fingers that I hit the 2 twice instead of the 1. So sorry.
I thought maybe you're just trying to have secret elections.
Yeah. You got to watch me. No,
Are you campaigning, Dr. Bobrowski? Are you campaigning to be chair again?
well, I can if the other TAC members, I don't mind.
There you
I
go.
don't mind at all. So if they want me to be the chair, I don't mind to do it again. Of course, some of you all know it that do this. It takes a little while to put these agendas together and try to make sure you got all the stuff in there. And I found that my other little note is right plain as day to see it. I just forgot to type it in on that about the social determinants part of it. So anyway, I may go ahead, since we're going to get done early this time, I may go ahead start now and get my agenda started. And that way I'll have it going and get everything right. But well, folks, that's all I've got. And of course, in the next meeting, as long as we get our TAC folks in line here, we'll probably be a little bit longer because we want to listen to folks' social determinants part of it. So we plan on a little longer one there, and I'll try to keep other things shorter. So we do want to hear about that, and then we'll also be probably hearing from Dr. McKee on her survey. So some pretty important things coming down the road. That's all I've got, folks. I even had extra paper out here ready to take notes and write things down, but I guess I'll just save it for next time.
There you go.
Garth, did you hear me?
Yes.
This is John Gray. Can you hear me?
Yes, I got you, John.
Okay. I can't get the video, so I don't know how many state people are there. Are there many state people there? Medicaid?
Lee Geis is here.
Okay. I just need to make a statement with regard to oral surgery.
Okay.
I've got another minute or two, Garth.
Yeah, go ahead. Yes.
When we evaluate a patient for surgery, on one hand, we weigh the risks of the surgery. That could be heart attack, stroke, infection, numb lip, numb tongue, broken jaw, pain. What are some of the
factors that people encounter when they're having surgery. That goes under the risks. And that's something that we have to or should evaluate with each patient. On the other side of the equation, we look at the benefits of the surgery. Are they in pain? Can we relieve the pain? Are they infected? Can we relieve the infection and prevent hospitalization or systemic effects from chronic infection? Can we replace missing teeth, implants, etc.? That's the other side of the equation. That's the benefit side that we need to look at each time we see a patient. And in terms of running a practice, we need to do the same kind of things. And we need to look at the benefits of being a provider in the Medicaid system versus the risks. Number one, there is the benefits. We provide jobs for staff and ourselves and tax-paying members of a community and of the Commonwealth of Kentucky. We provide, by being a member, we can provide finances for that provider. We hopefully serve humanity and we serve the people of the Commonwealth to make their life better. Those are the benefits, just a few of the benefits of being a provider. The risks are lawsuits, dissatisfied patients. I'm aware of 2 separate lawsuits in the state of Kentucky at this time from patients who are either dissatisfied or unsatisfied Medicaid patients who have not had the kind of experience that they expected to find or expected to have. They enter the office thinking that they are covered by insurance. And as opposed to being grateful for being seen in an office where we oftentimes are paid, we don't cover the cost of the procedure. That comes out of the provider's pocket, personal income, to provide the procedure. So we're not, I think Dr. McKee mentioned 2 or 3 meetings ago that the reason that you would not have a wait to see patients if it were a private pay patient or an insurance patient. Well, of course not, because the provider is oftentimes having to pay out of his pocket personally to treat the patient. So there's a disconnect on the risk side that patients do not understand, that there's with what we're being reimbursed, there's just not a profit margin. We're doing that because we want to serve them, we want to serve humanity, but there's a disconnect from that. Because of these things, on a personal note, and I'm saying that this time next year, I will not be a provider for Medicaid. And I don't know if it will stop in January or March or June, but I do know with the increased costs that we are burdened with because of COVID, increased staff turnover, gowns, masks, cleaning supplies, time, etc. It is just not viable. It was close before COVID, but at this point in time, the risks in an oral surgery practice outweigh the benefits of doing it. If after that time, when we get out of Medicaid, if I choose to treat someone who is infected or in pain, which I will, I'll provide it for nothing. But hopefully there will be an appreciation on that patient's part that we're doing it because we want to serve them and we want to serve humanity. And it will eliminate, because the $35, $40, whatever it is for a tooth, doesn't even come close. So I'm just giving a notice, and I'll give an in writing notice to the providers at such time as required by our contract. But just wanted to let you know that. Thank you so much, Carson.
Okay. Well, thank you, Dr. Gray. And we, and I do want to pass on some accolades to Dr. Gray, because I was on the phone with another dentist Monday night, and from up your way, Dr. John, and he was speaking so highly of you and your commitment over all the years and decades of, you know, being a Medicaid provider, and especially here these last, you know, several years that you all in your office and your staff have gone above and beyond the call of duty. And you're right. I think a lot of dentists want to help people. That's just a basic tenet. And but it's still, at the same time, it does get down to the point of you know, we're human beings too, and we can only do, you know, so much on a day, and then still, you know, pay the bills. But we appreciate you, John, and I wanted to pass on that compliment that I received about you last Monday night, because you and your staff have gone well above the call of duty, and thank you for your service, Dr. John, and all these years.
I appreciate that much.
Dr. Gray, I know, you know, I'm not really speaking for the commissioner, but I'm very sorry to hear that Medicaid participation has caused such or put so many risks on your practice. And certainly we appreciate everything that you've done in the past for our members. And I will be happy to pass along your message in hopes that we can, all of our partners, do something to assist you changing your mind. Just so you know, that will be our purpose, is to change your mind. So we appreciate you very much.
Thank you so much, Charlie. I appreciate all you guys, and I know everybody's heart's in the right place, and we're all just trying to do the best we could do. But COVID has been a real game changer.
Yes.
Yes, sir.
Well, I was talking this morning with some folks, and they, you know, it's just like the masks that we wear, you know, 2 years ago or thereabouts, or 3 years ago, we could get these for, you know, 50, 60 cents each, you know, and toss them, you know. Though now those masks, I bought several cases because we thought that, well, there was a shortage, and I was able to get several cases, and they were, I think it was $6.50 each or $5.95. So instead of it being a 50 or 60 cents mask, now they're, you know, they're about $6 each. You know, and still sometimes you've just got to shop around, you know, for some of these supplies. But it's the supplies that I had another meeting this morning with one of my long-term staff members that she's worked with us for 41 years, and you know, and she very well realizes the business end of doing this dentistry stuff, and it's just hard for all of us to really to make ends meet. But anyway, I won't beleaguer the afternoon. It's still sunshiny down here, but we may get out of here early today. Is there anything else that anybody wants to bring up, or anything we need to do research on, or kind of get prepared for the next meeting?
Dr. Bobrowski, hi. This is Dr. Babbage, Passport.
Yes.
I'd like to say to the other reps that if we're going to talk about the social determinants of health, there are 5 main categories, and we may be better by each one of us picking one to present, and then we could have a discussion around it rather than each one of us touch on various pieces of each one. Is that something anybody would be interested in?
That sounds like a good idea to me, that and still we'll leave the door open for, further discussion
Discussion.
on each. Yeah.
Right,
Um,
right,
Yeah.
right.
Yeah, I appreciate that, Dr. Probelski. I would leave it open so that if we wanted to talk about some other things that might be useful for the dentist to know, I would still like to bring up some of those. This is Jean from Anthem.
okay.
Thank you.
And I do not have those 5 categories in front of me to make any kind of assignments, but and that might also help us to, because I know we do have limited time with our TAC meetings, but that would maybe let each group do one of those, and still leave it open for discussion and more information from anybody. From the MCOs, that would be, I think, would be great. But why don't we? Or go ahead.
I can say them now, or have you all mail them out or pick one or whatever. Because I don't have access to everybody's email, I don't think, but I can tell you what they are.
Can you
Okay, go
drop them in the
ahead.
chat?
I'm sorry, this is the court reporter who's speaking.
Oh, Dr. Babbage, passport.
Thank you.
No, I'm on my phone. I couldn't get on the computer. I couldn't get in.
Okay, if you go slow, I'll put them in the chat.
Okay, thank you. Economic stability. Education, access, quality. Healthcare, access, and quality. Neighborhood and built environment. Social and community context.
Neighborhood,
And built environment. Those go together.
okay, got it. What was
And
the
then
last
the last-
one?
Social and community content, text rather.
Okay. I'm gonna clean this up and put it in the chat just a second.
And since I can't see it, I'll take whatever's left over if somebody has something they particularly want to talk about. And I would like to see, I'm a former chair of the Board of Health, so, this is my thing, but I'd like to see a rural aspect and an urban aspect because it's different, to mention both of those since we are treating both, which could be different in some areas than, us urban folks have a different challenge than the rural folks sometimes.
That's a good point to we can, add that to our discussion next time.
Thank you. And somebody can just tell me before the meeting's over which one that they didn't pick, and I'll pick one, and I'll take whatever's left since I can't see it.
Okay, I'm just gonna go down the list here and just if you want one, I'll tell you what, you better get on there quick because I'm gonna go right down through there and put on there what you want to take, or else you might get assigned one of them. So economic stability. Or go
I was
ahead,
gonna
yes.
say, one point is we've got 6 MCOs and 5 topics.
Uh-oh, we have 6? Okay.
I
I thought it was perfect.
I'm kind of thinking maybe we be prepared for all of them, and then I don't know, like each of
Okay.
us be, and then maybe at the meeting call on whoever, start with whichever MCO. Okay, you go, and assign at that time. I don't know. That's just a thought. Maybe we all prepare for each of them, but maybe we just
Okay.
present on one at the meeting, as decided at the meeting. That's just a thought.
Well, and that was kind of what I was wondering. In a way, I think it would give us a chance to look at different folks' perspective on each item. And then when we start discussing them, that'll be a good time to, I can call on somebody to report, but then as we're in the discussion part of it, that'll open up the floor for other MCOs to, add in some other ideas, comments, stuff like that. Does that sound like a plan?
Okay, sounds great. Thank you for listening.
Yes. So I'm gonna mark a note just to prepare, each MCO prepare for all 5 determinants. And then keep in mind the rural and urban aspects of those. And then we'll talk about them at our next meeting. And then Lee has got it on there, all of the on the chat room there, if you can see those. I think, yeah, I've got it there. All right. Do you feel like it's on the chat room there? If you're on the phone or something, you could screenshot it, or do you want us to send out an email concerning those 5 social determinants, or are we okay with the information that's presented here on our screen?
It'd be
Now,
nice
don't
to get an
everybody
email.
talk.
Well, I was going to say it'd be nice just to have a quick email if that's possible.
Okay, I'll do it.
Appreciate that.
I'll get them listed down, and then I'll send it to the directors, and then I'll let you all dispense it to whoever you want to work on this. So,
Thank you, Dr.
all
Bobrowski.
right. Yes.
Thank you.
And thank you all for your input on that. Any other questions, comments?
Doris, John Gray again. One more
Yes.
comment.
Yes.
I'm not sure if it's pharmacy. I'm not sure where the electronic prescriptions come in. Until the infrastructure in Eastern Kentucky improves, it is a major problem getting this to work. And we're spending, I'd say 2.5, 3 minutes per patient when everything goes great. But we have trouble on our end, east toward Mount Sterling, and we've invested $60,000 in the program. We've invested in Spectrum, and we've invested in AT&T Internet, and still there's an hour or two every day that we don't have internet connections, and the same things with the pharmacies in Eastern Kentucky that we're trying to get to. So until we have an infrastructure for electronic prescriptions, we're going to need some kind of, we've applied for another waiver so we can do it, but we need to be able to have a waiver or an alternate method of implementing this program, whoever decided to implement it, so that we have an option and we don't send out patients who have just had surgery and need the pain medicine then, and they can't wait 24 to 48 hours to get a prescription. They're going to be hurting as soon as the local anesthetic wears off. So if you could bring that up at MTAC about pharmacy or whoever implements this program, we've got to have an option to override the system when the system doesn't work.
I agree with you, John. I'm in a more rural setting than you are, and more some days it's I mean, we can't even get on there to check our Medicaid patients in, and we try to do that first thing in the morning, and sometimes our internet connection is just fluctuates, and I've signed up with iPrescribe, and it up until just a little bit ago, everybody wants to go all to all this electronic stuff, and they want you to sit through, send them emails, and then you get on their site, and they've got like 200 questions of tutorials. And it's like, well, somebody just pick up the phone and send me what I need. I'm having some of the same problems, Dr. John, with this iPrescribe. Now, what we're hearing in our part of the state is just that the pharmacies will still accept a handwritten prescription. At least that's what I've been told. And sometimes our system will work, and sometimes it just won't work. And I'm still waiting on this company to send me I've paid for it twice, and they still haven't sent it. It's I call it a key fob, but they call it a token, and it's supposed to help give you the second authentication and verification for that prescription. And they finally put a phone number on their website, and but who's got time to sit there for half an hour or longer? Or you leave a message and nobody calls you back. You email them, nobody gets back with you. So this system, I hope other people are having better luck with it, and it's not because I'm old and gray. I put some of the young people on it, and they still can't have any luck with it either. So, but it is a problem, Dr. John, and I'm hoping that they can get that worked out, or like you said, get some more waivers. Or but now we're being told in our area from our pharmacies, just write it out and they'll still accept it. But that's a good point. All right, any other business topics to talk about? All right, going once, going twice. Sold, and we're gonna close this meeting out, and I sure hope everybody has a great weekend. And I know Thanksgiving and the holidays are coming up, and we hope you and your family have a blessed holiday season.
Thank you, too.
You too.
Thank
Happy
you, Dr.
holidays. Bye-bye.
Thank you.
Bye-bye. Bye-bye.